Hello, and welcome to In the Spotlight, a special presentation of Healthy Connections. Today, we'll be highlighting Shatterproof's ATLAS Treatment Locator. Our keynote presenter will be Angad Buttar, who is the Assistant Director of State Engagement of National Treatment Quality Initiatives for the Shatterproof organization. Before we get to the demonstration of the ATLAS Treatment Locator, we'd like to tell you a little bit about the other individuals you'll be hearing from today. I'll be kicking things off and emceeing the event. My name is Shannon Wright, and I'm Director of Innovation for Quality Insights. We'll also be hearing some Delaware perspectives from Amy Porter, who's a practice transformation specialist. A little later, we'll have Q&As, plenty of time for Q&As, and that'll be facilitated by Crystal Welch, who is a lead project coordinator. And today's webinar is being produced by Misty Dyke, who is a communications specialist for Quality Insights. You'll have the opportunity to submit as many questions as you like during today's presentation. You don't have to wait until we come to the interactive portion at the end. You can submit them at any time using the Q&A or chat feature in WebEx. If you're not familiar with the Q&A feature, you can open this by dragging your mouse to the bottom of the screen and clicking on the three dots in the lower right-hand corner, then selecting Q&A from the drop-down menu. You can type your question in the Q&A feature at the bottom right of your screen, then hit send. It's that simple. Our questions will be addressed in the order which they are submitted. If you prefer, you can also use the chat feature in WebEx. To do so, simply open the chat feature by dragging your mouse to the bottom of the screen where you see the little bubble in the word chat, and you can click on it and submit your questions for anybody who's speaking on today's webinar. For those of you who are not familiar with Healthy Connections, we are a coalition based in Huntington, West Virginia, with the mission of helping pregnant women, mothers, and their families navigate treatment and support services available in the community. Healthy Connections is proud to have more than 30 Huntington area agencies working together with this shared mission and goals. You heard a lot of titles from Quality Insights. If you're not familiar with Quality Insights, we are one of the largest nonprofit organizations devoted to improving healthcare quality. We use data and community solutions to achieve the goals of better care, smarter spending, and healthier people. We have more than 300 employees and consultants who are vastly wide-ranging in experience, including healthcare delivery, continuous quality improvement, medical record abstraction, data analysis, information technology, social marketing, and much more. For Healthy Connections, Quality Insights provides in-kind services, including the coalition's marketing, branding, web infrastructure development, partnership coordination, resource creation, earned media, advertising, and webinar production, just like today's special spotlight presentation. In addition, we'd like to tell you about some of the other work that Quality Insights is undertaking here in West Virginia, where we are a quality improvement organization, Quality Innovation Network, or QIO. We perform this work on behalf of the Centers for Medicare and Medicaid Services, or CMS, and Quality Insights is proud to have nearly 50 years of experience working for CMS in this capacity. Our headquarters are located right here in Charleston, West Virginia, where they've been since 1973, and you see depicted on the screen our corporate offices in Kanawha City. Our work as a QIO in West Virginia includes improving behavioral health, such as reducing depression and reducing dementia. We decrease adverse drug events, such as opioid and opioid misuse, anticoagulants, and diabetes drugs. We also work to increase patient safety and chronic disease self-management, including cardiac and vascular health, diabetes and chronic kidney disease, and we also work in care transitions, such as utilizing community coalitions, reducing hospital admissions and readmissions, and reducing avoidable emergency visits. Last but not least, we partner with nursing homes throughout the state of West Virginia on various initiatives to help them improve the quality of care delivered to their patients. At this point, I'm going to turn things over to my friend Amy Porter, who is a practice transformation specialist, to talk a little bit about Quality Insights work in Delaware in addition to West Virginia. Amy?
Thank you, Shannon, and good afternoon, everyone. Thank you for this great opportunity to provide a very brief overview of a number of projects our Quality Insights team in Delaware currently works on in cooperation with the National Association of Chronic Disease Directors, the Delaware Division of Public Health, the Delaware Cancer Consortium, and the CDC. On both this slide and the next, you can see that a bulk of our work focuses on partnering with local healthcare sites and providers to promote and facilitate improved quality improvement delivery. And a lot of these projects, especially here, are focused on the prevention and management of things like prediabetes, diabetes, high blood pressure, and cholesterol. We are also spearheading an exciting cancer screening quality improvement initiative that currently has more than 40 physician practices in Delaware who participate. The current primary areas of focus, you can see colorectal cancer highlighted here. I'm sorry, it's not allowing me to advance the slide.
Okay, I can jump in for you, Amy.
Thank you.
No problem.
Thank you. So including the colorectal cancer project that was highlighted on the previous slide, you can see the other ones that are listed here as well. These initiatives are targeted at increasing screenings for lung, breast, and cervical cancers as well. And on our Quality Insights website that is linked here at the bottom of this slide, you can find a lot more information about many of the projects that I've outlined here. And also from that site, you can access more information about how Delaware practices can participate in these projects and find appropriate contact information, as well as a host of valuable tools and resources that may be of interest to your practice, including Delaware Public Health e-learn courses that are available to any Delaware medical practice at no cost through June 30th, 2021. Next slide, please. And as it relates to the great work that is being done currently through Healthy Connections, I thought I would just take a quick opportunity to highlight two specific Delaware programs that enhance the quality of care provided to women specifically. And the first is the CDC-funded Wise Woman Project. Wise Woman collaborates with healthcare providers to provide qualifying women with a selection of pre-screenings and counseling about their risk for heart disease and stroke. These services include risk reduction counseling and other options such as health coaching, lifestyle programs, and other healthy behavior support options to improve control of hypertension and other cardiovascular risk factors. And for the healthcare community, these services are really designed to promote lasting heart-healthy lifestyle changes and ultimately enhance quality performance for measures from both the Medicaid Adult Core Set and Delaware Medicaid Quality Performance Metrics. Next slide, please. Another correlating initiative is Delaware's Maternal Health Project. Delaware statistics have shown higher than average rates of poor birth outcomes in certain high-risk zones. targeting females in the city of Wilmington, Delaware, aged 15 to 44. This particular community-based project utilizes community health workers to assist in developing what's known as a closed-loop referral mechanism to facilitate a client's referral to and receipt of a wide variety of services that are available in their local area. These connections provide the necessary resources that are needed to promote a healthy lifestyle for women and mothers, which in turn increases the likelihood of a healthy future for their little ones. Again, I just want to thank you so much for the opportunity to do this very quick drive-by of the Delaware initiative. We have a number of staff who are passionate and dedicated to advancing the work that I've described today. So should you have any questions related to any of the services that we provide, you can contact me directly at aporter@qualityinsights.org or get in touch with your personal Quality Insights contact, and we would be happy to connect you to more information. And with that, I'll pass it over to Shannon for the next portion of today's presentation. Thank you.
Thank you so much, Amy. Great information. And in case you didn't jot down Amy's email address quickly enough, we will have a slide coming up that has contact information from everyone you're hearing from today. So whether you're in West Virginia or in Delaware, we are here to help you with a wide variety of initiatives at Quality Insights. I see some questions are already coming in through chat and Q&A. Thank you for doing that. You can keep those coming. We will have a reminder of how to do that if you're not familiar with WebEx as well. But with that, it is my great pleasure to turn on today's presentation over to our keynote presenter, who is Angad Buttar. He is the Assistant Director of State Engagement, National Treatment Quality Initiatives with Shatterproof, and he will be giving us a tour of how to use Shatterproof's ATLAS Treatment Locator.
Thank you, Shannon, and good afternoon, everybody. I hope everyone is doing well and staying healthy during this time. So I am sharing my screen. Just bear with me a minute. So this is ATLAS, our Addiction Treatment Locator Assessment and Standards platform. We launched this platform back in July of last year, in 6 states, those being West Virginia and Delaware, New York and North Carolina, and Louisiana and Massachusetts. As of right now, we are looking to expand ATLAS, and please stay tuned as we will be announcing the states in which we've launched in 2021 across the next few weeks and few months. So the web address for ATLAS is treatmentatlas.org. Once you arrive to the launch page here, you can scroll down, and there's 3 things I would like to point out here. First is the take assessment function, and I will click on this in a minute so you can see that assessment. The second item is the treatment locator capability. So you can search by zip code, city, or state. You can enter in a mileage radius, and you can also enter in an insurance option here as well. The third option that I wanted to show is the high-quality addiction treatment and what that looks like. On the left-hand side here, you can see the Shatterproof's National Principles of Care listed. These principles of care were derived from the Surgeon General's report on high-quality addiction treatment back in 2016. Based on that, Shatterproof took that report and, with the help of other leaders in addiction treatment across the country, these were sort of the 8 principles that we wanted to include in ATLAS that talk about high-quality addiction treatment. The third item, in addition to that, is a little video here that has some educational content on ATLAS and receiving high-quality addiction treatment. And as you can see here, it's about 2 minutes in length. So as I scroll back up to the top here, you can see the assessment button that I referred to earlier. So I'll go ahead and click on that button. And based on this addiction treatment needs assessment, this was developed in partnership with the American Society of Addiction Medicine and Open Beds. This assessment is 13 questions and takes just under 10 minutes to complete. And at the end of the assessment, a sort of recommended level of care is provided. Now, in the interest of time, what I'll go ahead and do is start the assessment, but I did complete it so we don't have to go through the entire assessment right now. So to start the assessment, you can either take it for yourself or for a loved one. So I'll go ahead and start that. You can search by various substances that the individual might be having problems with. So in this case, I'll select heroin or fentanyl. And then the next question is, are they able to stop using this? Are these substances, or are they using every day? For this, I'll select if they can stop, but might use again in the next week or so. So as I referenced, I have a completed assessment here. And so I filled out the rest of the assessment as if the individual that I was sort of trying to seek care for is having sort of a moderate issue with heroin and fentanyl. So once you click submit, this is sort of the results page that populates. As you can see here, the treatment type list is listed as intensive outpatient treatment with additional services for medications for opioid use disorder, withdrawal management, and then mental health monitoring and treatment. There are also little icons here with little information that if you hover over and click on it, provide some context on what is exactly meant by intensive outpatient treatment and medication for opioid use disorder. So from here, I will click on the Find Treatment Now button. And so for this, I will go ahead and select Charlestown, West Virginia, and I will select a 100-mile radius, and I'll go ahead and click Submit. And so from here, my search results page populates. And so on the left-hand side are filters that I would like to walk everyone through. So first and foremost, we want to see facilities where the quality data has been provided. In ATLAS, we, based on our partnership with the states, have all treatment providers listed that are licensed and in good standing with the state. We also provide surveys. In this case, we did this late in 2019 and early in 2020, where treatment facilities had the opportunity to provide us with information on their specific facility in terms of the types of services provided, et cetera. As I continue to scroll down, you'll see filters for substance focus, payment options, whether or not private insurance is accepted, treatment type. Now you'll see here that intensive outpatient is automatically checked because, as you'll recall, that was the recommended level of care based on the assessment that I just completed. So all that information carries over into my search results. You can also filter by facility features, coordinated for mental health and physical health, medications for opioid use disorder, for alcohol use disorder, if there's age-specific programming, special group served, and whether they're LGBTQ plus welcoming or not. So as I scroll back up to the top, these are the 3 facilities that matched my search. So what I'll go ahead and do next is click on the Mountaineer Recovery Center. So here is a facility profile. So listed is the name of the center, their website, their mission statement, phone number, address, etc. As I continue to scroll down, you can see that there's a tab here which is already selected for outpatient program. And if facilities have multiple programs, those will be listed here, and you can toggle between the separate tabs. As you continue to scroll down, you can see the facility information and features in terms of treatment type, substance focus, insurance and payment options, facility hours. As I continue to scroll down, additional information on specialty groups served, and so on. Next is the signs of high quality care. And so this is where ATLAS separates itself, because we have listed the signs of high quality care that I referred to earlier, a brief description on those, and whether or not those services are available at this specific facility. So again, you can see the signs of high quality care and the check marks, and there's a little legend here that mentions what you'll see what the different options might be. So a green check mark indicates that a service is available or it meets the standard. The golden dash means that the service is not available at this facility's physical location, but it is available through another affiliated site. And the red X simply means that the service is not available. So as I continue to scroll down, you can see that there is a see more information option here. Again, to provide additional context and information on what we might mean by personalized evaluation and treatment plan. And individuals can understand the additional detail and information that is provided. As I continue to scroll down, you can see a few more of those see more options. And again, more of those tooltips where if you hover over the little information and click on it, provides additional information and context. As I continue to scroll down, you'll see the additional signs of high quality care listed. And in this case, you see that golden dash under the coordinated care for mental and physical health. And in this case, this facility doesn't offer primary health care, but they will, at that location, but they will connect the patient with that care. And as I continue to scroll down, you'll see a patient review section. So this allows patients, clients, their family members, and loved ones to leave feedback based on their experience in receiving treatment. Now, a couple of things to note here. First, the questions in the patient experience survey are based on the Agency for Healthcare Research and Quality, so the AHRQ, questions that are that obtain information that alludes to sort of high quality care. Also, answers to the survey do not populate until 20 responses have been submitted. And that's just to protect anonymity of those that might be completing the survey. The third thing I'd like to point out is the responses must be in adherence to Shatterproof's terms of service. So what does that mean? That means making sure the responses do not call out a specific individual, and that all language is sort of appropriate as well. The responses also go through something called natural language processing, just as another validation check, and there is a human level review as well. The responses to the site will stay on for approximately 180 days, in which case those reviews will fall off and make room for new reviews that are listed. So what I'll go ahead and do next is scroll back up. And I would like to show you the Add to Compare feature. So if I click on Mountaineer, click Add to Compare, I will look at their outpatient program. I will add to compare. I will return to my search results, and I will add Winchester Community. And you can see this little thumbtack it populates to show you it's been pinned to your compare. And then I will look at Paloma as well. And so once 3 facilities are selected, you can go to your compare. And one thing to point out here, when you're using a computer, so whether it's a PC or laptop, you can select up to 3 facilities to compare. If you're using a tablet or a smartphone, you can select up to 2 facilities, and that's just due to the limitation in screen size. So once you go to the compare feature, you can see sort of the same information that you saw earlier in the facility profile, but just listed a little differently. So here you see the 3 facilities across the top, their address and demographic information, the facility features, and then the signs of high quality care, right? So based on what might be important to you or your loved one, you can understand based on the 3 facilities that you selected, what are the services that might be available? And again, you can see the 3 facility names across the top. As you scroll down, you can see how that might differ as it relates to the green check marks or the red X's. And again, the idea here is not to be, well, a red X is bad, green check is good. It's more about what services are available versus not based on your specific situation. As I continue to scroll down, you can also compare patient reviews. In this case, you can see that Mountaineer Recovery Center has 43 reviews. Winchester and Paloma have not had a minimum that minimum threshold has not been met of 20 responses yet. Once the survey is completed, it is updated every 24 hours. But as you can imagine, in this sort of new age we're living in, where a lot of services may not be in person, it's been, I think, a sort of slower uptick in terms of receiving the patient reviews. What we are hoping to do as we move on into 2021 is work closely with our treatment facilities to understand how can we partner and work together to increase the patient experience review submission rate. For example, right now, one limitation is if you go to, in this case, Winchester Community Mental Health Center, and you go home and you want to search by that facility to leave feedback, ATLAS does not allow you, as of right now, to search by that name. And that was a limitation we knew as we went live with the platform. I will say the team is working on that as we speak, and that should be, search functionality should be available in the coming weeks, if not in the next month or two at the most. But also working with our facility partners in terms of understanding if there's other sort of electronic modes that this can be delivered in, whether it's a QR code or other such technology. So we are sort of searching and developing those recommendations as we speak. So that is the sort of formal demo. A couple of things just to highlight. As I mentioned, ATLAS went live on July 21st, 2020 in the 6 states I mentioned. We are looking at expanding and are expanding sort of as we speak, having conversations with states on the East Coast, Mid-Atlantic region, in the Southeast, and on the West Coast as well. And so we're looking at going from serving roughly 13% of the population to almost, I think, 44% of the population if everything, if all the conversations that we're having currently sort of move forward. So we're looking forward to expanding ATLAS in 2021. And if there's any questions, don't hesitate to let me know. And that is the end of the formal demo. So I think at this point, I would like to pass it on to Crystal Welch.
Well, thank you very much, Angad, and we have certainly learned a lot and gleaned a lot of information, and we certainly appreciate your time, but we do have several questions that have rolled in, and we're going to start with our chat box first that came at the top of the hour, but before I do that, thank you for putting the slide back up with how to submit your questions. So if you can just go down to the lower right-hand side, you will see the participants and the chat and the three buttons, or the three little dots, and you can submit your Q&A there, or you can use the chat feature. So if you have any questions about that, hopefully that answers your question. But let's go ahead to the first comment that we had in chat at the top of the hour from Kim. And she just kind of pointed out something. It says, in ATLAS, some West Virginia providers are listed as OTP, an opioid treatment provider. While OTP may have multiple meanings, the traditional definition is the equivalent of a methadone clinic. Could the OTP designation be changed to MAT for providers that do not provide methadone, but will provide other forms of medication-assisted treatment, buprenorphine, naltrexone, etc.? How could that be accomplished?
Yeah, so Kim, thanks for that question, and that's a great question. So in West Virginia, if there's an individual provider that's practicing, say, under their own name, that was not in scope sort of as we started our data collection. But if it's an office-based MAT provider, they were in scope for sort of our phase one data collection. Now, as we move forward, in terms of broadening that definition. I think that's something we can certainly work with our state partners to see, how that might work. And we're certainly seeing that very same question in some of our other states as well. So that's kind of how we defined it as we started, and that's sort of also kind of the path that we're going to take as we move forward.
Great, thank you so much. And Kim also says thank you in the chat. So the next question, it says, does ATLAS only locate inpatient addiction treatment facilities, or does it look at outpatient and residential as well?
Yeah, good question. So if you recall, based on the assessment that we have, we look at inpatient residential, outpatient, and intensive outpatient. So all of those facilities that are, in a state and licensed will be in ATLAS. Now, we always work with our state partners to provide us sort of with that initial list. And then, of course, we'll scrub it. I think we also obtained lists from, SAMHSA, the national organizations as well. But when it comes to working with the states, we sort of get all the information we can and then, conduct a validation process to make sure that all of the facilities that are listed in ATLAS are sort of up and running. Another question that I've gotten over the last, several weeks and few months, unfortunately, given the sort of, time that we're in with COVID, some facilities, unfortunately, have had to close their doors. And so we try to update the database as soon as we can in terms of, if there's a facility that closes. The flip side is if a facility comes online, we also want to update that facility to include it in our database. The one thing that we are not able to update real time as of right now is that quality information. That's sort of an in-depth process that requires sort of surveying the facility, working with the team to obtain the results back. We conduct our own sort of validation. We had a third party conduct that validation in the first phase of ATLAS. And so that's sort of a time-consuming process that can take up to, a couple of months. Having said that, we're looking to sort of streamline that process and still have the same validation sort of in place, but be a bit more real time in terms of if a new facility comes online, can we conduct that data collection in a more expedient time period. We're not there yet, but we're certainly, working internally to see how we can do that.
That's great. Thank you so much. That kind of leads a little bit maybe to this next question. It says, how do we know that the treatment facility provides quality treatment? Sadly, there are agencies that have seen the opioid crisis as a way to make money, and the services are not legitimate. What is the vetting process to make sure that services are legit?
Yeah, that's a great point too. So when we send out our treatment facility survey and we get the answers back, there is a robust validation protocol that I was just referencing earlier. So, for example, if a facility says that they operate an electronic health record, well, we ask for a screenshot to sort of validate that. Our vendor, our third party that we worked with in phase one, would also conduct sort of, I think, third party sort of reviews and interviews with a sort of a hand-selected number of facilities in each state. They had their own methodology to do that. But again, the goal there is to make sure, as the question alluded to, that the services that are provided are in fact provided. We also do have a patient experience survey. So if the facility mentions that they have, fast access to treatment or that they provide primary health care on site, that's another sort of quick way for us to understand is that in fact the case or not? We are also, and this is something that we're looking to sort of develop in 2021, we also do want to work with our state partners to first identify any sort of actors that might be providing services in bad faith, or if there's major quality issues. We want to make sure that we sort of are aware of those, number one, and then number two, can we sort of flag the facility, as well? We're not there yet, but it's certainly a concern that we've heard about. We just want to make sure we are surfacing those and identifying those in sort of a fair and equitable way as well. So that's sort of where we are with that as of right now.
All right, and let's see. The next question says, what if there's a license or state-recognized agency that isn't in ATLAS? Is there a way to make you guys aware?
Absolutely. So you can email myself, or there is a atlas@shatterproof.org inbox as well that we monitor. If you're in a state where ATLAS is live and a new facility comes online, please reach out to really anybody, but atlas@shatterproof.org inbox would be best, or don't hesitate to reach out to me as well. I think Quality Insights will share my contact information, and I'll be more than happy to share that with my internal team.
All right, we just have a comment. It says that the add and compare button is very cool. It reminds me of an Expedia or Kayak. Thanks for the demonstration. So that was a comment. And it said, let's see, the next one says, you mentioned quality measures. Are those claims-based, and do they include all substances such as alcohol?
Yeah, so the substances and that you're able to search and filter from do include alcohol. In terms of the quality measure, that's a fantastic question. And so we were looking to include, I think it was 4 claims-based measures. What we found was that states had a sort of a difficult time in providing us with that claims-based data. And then as sort of COVID, came about, as you can imagine, state resources were incredibly scarce. And so for this coming year in 2021, we're not sort of focusing too much on that claims-based data for the reasons I just mentioned. But having said that, I think we're really wanting to sort of reapproach that as we continue to grow in 2022.
Great. And this it just says, has ATLAS taken into consideration different payers and insurance coverage for the treatment locator?
Yes, absolutely. So we do have a filter. I'm not sure if you saw early on, where you could filter by insurance company and whether whether it's private pay or the commercial insurance. So we have, and that data is sort of only as good as what we get from our treatment providers. And we are looking at a way to sort of validate that as we sort of, get that data into the system. But that is something that we do have. And we also, I should add, have conducted sort of consumer group testing with folks. I believe it was New York and Massachusetts, where individuals have had experience in trying to search for addiction or high quality substance use disorder treatment. We conducted some of that feedback as they sort of used ATLAS, and we had some questions that we asked them, and that was one feature that many of them liked. That sometimes the state will have a locator, or there's obviously the SAMHSA locator, but that was some feedback that we got that's always stuck out in my mind. That searching for treatment under what can be difficult circumstances is always tough, but having that sort of financial component in the back of your mind and having that ability to search by that is always certainly helpful. So that's something that we're proud of and glad that folks are finding value in having.
That's great. Well, I guess maybe while some other people are thinking of questions, you said something that kind of spurred me, so I'm just going to throw one out there myself. So you mentioned one of the questions mentioned alcohol use as part of the substances. When you were doing the demonstration and doing the assessment, the drop-down box, it seemed to have a lot of things. Could you just, I don't know if you can just kind of off the top of your head talk about that, but basically does it mention all substances, like including tobacco, or is it just more, just talk a little bit more about that.
Yeah, sure. So, the substances, I think we tried to be as sort of comprehensive, as we could. And I don't believe it's got, every single substance sort of possible. I do know that, again, we tried to look at, what are, the main groups that facilities sort of treat for. And so I think that was sort of the genesis of how we developed that list.
All right. Well, we have another question. It says, does ATLAS look for referral services for behavioral therapy and MAT, I cannot talk. I'm so sorry. Medication-assisted treatment.
Yeah, no, good question. So we haven't looped into the state's referral process yet. I know that, some states are sort of focused in on, working with their provider groups and having systems that might be more streamlined to have that ability to capture that referral and then connect them to maybe a facility that could see a patient, right? So having locator capability in the function there. So that's something that ATLAS does not have. Not to say we're not looking for that and trying to understand how we could maybe have that in the system, in the platform in the future. For right now, I think what we wanted to make sure individuals had access to was information on quality addiction treatment. And so, having that ability to look for things, treatment that might be, have an appointment immediately, that is important, but we want to make sure that individuals understand that facility that can see me right now or that has availability, is that facility providing the services that I really need or that my loved one really needs? Are they providing evidence-based, best practice methodologies and treatment to treat the condition, right? And so that's where ATLAS is sort of more focused on. Again, having said that, is there an opportunity to sort of add in that referral component and that locator feature? 100%. And so it's something that, our IT folks are sort of looking at as we, again, continue to move forward and grow.
Okay. This one just says, I'm in Delaware. Are offices included, are offices who include MAT listed? In Delaware, offices that include MAT listed, they should be. I can double check with my team, internally, but if an office, if an individual is part of a practice or a facility that's providing MAT, they should be listed in ATLAS. Awesome. And this is the last one we have. It just says COVID has exacerbated overdose rates and substance use. Additionally, suicide rates are on the rise with the likelihood of maintaining isolation and safe distancing in the coming months with COVID. Has ATLAS looked into expanding for folks to get help with crisis intervention? Yeah, great question. So as we look to expand, right, services or, different modalities of care, right, telehealth, for example, we're certainly, looking at everything. Now, I know our leadership is not only taking that seriously, but trying to understand where can we provide the most impact, right? A lot of our states, I know I work very closely, with our partners in West Virginia, and I know in some of our other states, they have the crisis lines, the helplines that are either state funded or they work very closely, with their state partners. And so what we want to be cognizant of is, not necessarily duplicating efforts, but want to sort of integrate and work together where we can as well. So I know, again, that question is unfortunately, I guess, is very true in terms of the overdose rates and some of the other issues that we're currently seeing. And I think ATLAS and Shatterproof, we just want to obviously be a partner there to help where we can, but we want to make sure that we don't, duplicate any of the great efforts that the states and some of the other state partners are already sort of undertaking. Well, those are all the questions that I have in the chat and the Q&A. So at this time, we can turn it over to maybe to Shannon or myself. I can wrap things up. Shannon, do you have a preference?
I think all we have to wrap up is just the contact information that you see here on your screen. Please feel free to reach out to any of us presenting today about information. We'll be more than happy to assist you with your questions or comments that you have at any time. I'll pause for a moment to see if any of our presenters have any final words. And hearing none, we will wrap up today and would like to sincerely thank you for joining us for today's special Spotlight presentation. Have a great day.